My name is Reverend John Sumo. I'm the Director of Health Promotion at the Ministry of Health and also serve as the Chair on Social Mobilization, especially during the Ebola response. The first thing is to conduct this coordination with our key partners, in conducting the coordination so that we get to know the mapping where each of them operates. And then to coordinate our activities, where we go from there, we decide, make decisions to see on the messaging side and how we're going to mobilize resources. So dealing with the individual, you have to also look at it from the holistic standpoint to see how best the impact can be created when it comes to, the messaging, when it comes to the engagement, the interpersonal communication. All of those things combined help to, get you to where you want it to be in terms of social behavior change communication. How do you want behavior change to come about? Is it only creating awareness? I said, no, it is going beyond awareness, where people will adapt the behavior and then advocate with others so that they themselves will be able to carry on, behavior change activities. So that's the first thing is we have a risk communication operational plan that details communicating during an outbreak, after and before an outbreak. So that communication strategy, our operational plan is actually in place. And then one of the things we have done is to conduct a workshop for media personnel because they are also key in that. And then you have to look at the messaging as well. How are you still going to be carrying the old messages? So those are things that we are looking at. So if there's an outbreak, how do we make the messaging to have a greater impact compared to what happened in the past, where the messaging created a more negative effect on the population? So those preparations include in preparing the community, that is sustain community engagement, get in contact with the community on a regular basis. The messages we have from the early days of the outbreak really scared people that we said Ebola is deadly, it has no cure. And then we didn't look at the hope because we didn't know much about Ebola outbreak. If there was a case that would have done differently was attack the problem before it gets worse. So that is to say, move on to the community where it's coming from, build their capacity around that area so that they will be able to help to track down those are crossing over. Let's say from Guinea, from Sierra Leone, we have people crossing over. But if we had the resources at the time, that's what we have done. Probably it wouldn't have reached Monrovia to cause the devastation it caused at the time, looking at more than 4,000 people, losing their lives. So the community engagement did play an important role. The community took ownership. They were able to go about in the various communities to set up task forces that were able to, work with the ministry teams and other partners that were in their various communities. So when we engaged them, they embraced the whole idea. They took part into it, in the response, and they were part of it. And they took ownership, went from house to house, identifying sick people, and even those who were hiding. Some of the dead, bodies and other things, they were able to identify them. If you want a problem resolved at the community level, involve them.